All right. Well, thank you very much, and thank you, colleagues, also for joining me up here today. I'll be moderating this session and talking about this really important topic. We talk about technologies and digital disruption, but ultimately, the technology is only as good as the humans that are going to use it and bring about change. And so, in this particular case, we talk about the role of clinicians in a changing digital era. And what I'll do is I'll start off with a question for all of you, but before you answer that question, if you could just introduce yourself, share a little bit about your organization, and then get into your perspectives here. But a question again to all of you: how would you describe the role of clinicians today, if we were to sort of rewind to what it used to be about 10 years ago? And linked to that, what would you say are the biggest challenges that they face? So maybe Sam, I'll start with you, and we'll work our way down.
Yeah, thank you so much. The way I see it is that. So, would you like me to give an introduction?
Yes, please.
First, of course.
And then,
I was just diving straight into the topic.
Yeah.
So my name is Sam Oddsson. I'm one of the two co-founders of Sidekick Health, where I serve as the Chief Medical Officer. We are a digital therapeutics company, modernizing and transforming how we manage chronic diseases with a platform that covers more than 20 conditions, working in the prescribed digital therapeutic space with the world's most prescribed digital therapeutic in Germany, and health insurers in the US and pharma.
Yeah. Shall we do the intros first and then go to the question? Maybe that's a better process.
Yes.
Yeah, go ahead.
I'm Harry Lykostratis. I'm an orthopedic surgeon. I started as a software engineer, and then I did surgery for many, many years. And 5 years ago, I founded Open Medical, and I'm currently working mostly as an engineer and sort of founder of Open Medical, and we do enterprise digital health solutions that they usually sit at the regional level, and they do coordination among multiple providers. So very back office technology.
Mm-hmm.
So my name is Johanna. I'm a trauma surgeon from Berlin in one of the main trauma centers in Germany. I've got a master's in surgical science and practice, and was always interested in digital health, worked for one of the biggest NGOs in Germany and as a startup advisor for digital health processes, and always filled the bridge between clinicians and hospitals and the digital world.
Yeah, cool. Afternoon, everyone. I'm Daniel. I represent redalpine. Redalpine is a pan-European, Swiss-rooted, early-stage venture capital firm. We invest across software, life sciences, health tech in European and Series A ventures. Currently investing actively out of our 7th early-stage fund, and personally also a medical doctor by background. Joined redalpine almost a decade ago, and since then focusing mainly on healthcare technology investments in Europe.
Okay, thank you very much. So let's start with that question again, and again to all of you. What has changed over the past 10 years? What are the challenges that clinicians face in the digital era? Maybe Sam, will start with you.
Sure, I can start with answering this one. So for context, I come from seeing patients when I was practicing internal medicine and cardiology. So I'd say a lot has changed over the past 10 years, but I still feel that we are in the middle of it. So it's, on one hand, we have some concrete examples how digital is changing day-to-day patient care, but on the other hand, we have a whole buffet of hypothetical possibilities when it comes to how digital can change day-to-day care. Just to mention a couple of concrete examples on how things have actually changed from the day we started Sidekick is that, as an example, in the GP office or the outpatient clinic, physicians are now prescribing digital therapeutic solutions. And one reference for this is that more than 15,000 physicians have prescribed digital therapeutic solutions from Sidekick, and they're counting on these solutions to help them empower patients, to save them time when it comes to adherence support and lifestyle change support. Another concrete example is remote patient monitoring. We're seeing more and more of that. And the third example is that healthcare is now being provided by more types of organizations than only healthcare providers. Like we're seeing health insurers in the US stepping in. So, but again, we are in the middle of it, and it will be dramatically different if you will ask me again in 5 years.
Mm-hmm. Harry?
Can I add something? So I think from my practice, I've started practicing in 2005, I think, when I finished med school. So the two things that have changed mostly, I think, is one, I think we're consuming way more healthcare. I think over the last 20 years, we need more and more. We're medicalizing more and more of our lives. And I think the second thing is the cost of healthcare is escalating. So most of the systems now, both in Europe, Asia, in the States, obviously, is unsustainable. And I think the bigger problem, if we do not bring that back into a sustainable level, I think the biggest problem will be accessibility to healthcare. The healthcare for all will not be a thing in 10 years unless we somehow change that trend and that trajectory.
Mm-hmm. And any reasons for you seeing that big trend and trajectory? Well, what are sort of like the big drivers in your opinion for that, just as a follow-up?
I think we commercialized healthcare a lot more. I mean, especially here in Europe, we're supposed to have a more sort of population-centric care. It was, the idea was we will give health to everybody, and we will all share the cost of that healthcare, and we will all be healthy. And I think we started moving a little bit more into sort of patient-centric care, more of the American model, where you start monetizing healthcare. You start, it's becoming part of your expense. And obviously, in our case, that expense is to the taxpayer, and the taxpayer can only pay to a level. At some point, we will have to start subsidizing healthcare, and at that point, it will not be accessible to everyone.
Mm-hmm. Okay, thank you. Johanna, for you, adopting new digital tools and technologies brings its challenges. I'm just curious to hear from your perspective on the ground, how do you see that playing out? What have been the biggest challenges for you on digital adoption or digital technology adoption?
When you look at digital adoption or digital technology in the healthcare area, or especially with clinicians, you have to keep in mind the kind of people you work with. It's always a people's business. And clinicians and doctors are safety people. They like it safe, because when they treat you as a patient, this is what you want. You want to be safe. You don't want to be innovative. You don't want to be at risk. Mm-hmm. You want to be safe. And this is our culture. We always take safety first. So when you look at innovation or digitalization, it's something new. It's not what you're used to, so it's a risk. So it's even harder to implement digital tools or adopt digital things in healthcare, because doctors are prone to safety rather to something new or innovation.
Right, yeah, and I mean, at what point, and I'm sure, for you guys that have sort of seen this on the ground as well, at what point is it an asset? Because there's always like new initiatives, new tools. If you often go to hospital groups, people all have their own individual apps that they like to do different things on. At what point does it become a burden as opposed to an asset? When is it just lots of fancy tools, but not really achieving the outcome that you need to?
I really like your question, because I think that's not a really important thing when you look at clinicians. Clinicians make things work. When we do patient care on a daily basis, you can't tell them, oh, I know you're in pain, I'll come back to that. Let me rethink this. Give me a couple of weeks. We're used to saving problems in the moment they occur. And so if you give us a tool and it's not working for us, we'll still make it work, because this is what we're used to. We're used to making things work, not to going back to you and saying, this tool you gave us is not quite working out for us. It's not giving us any value for our workflow. We'll use it, we'll make it work, but it might actually not be the best tool. So the big challenge is to actually go back to the clinicians and find out, is it doing what I wanted to do, and is it adding any value, or is it actually making their life harder?
Okay, yeah. Do you want to have a follow-up, Harry?
Yes, I think if you look at the daily schedule of a medical doctor, it's super packed. And with medical tasks, we see patients doing administration. And I think innovation at the very beginning always requires that one person or one medical doctor in a clinic is willing to do initial extra work, going the extra mile to kick a project off. And get going. And without that willingness, I think it's very, very difficult to basically drive innovation in a clinical setting, I believe.
Okay, and maybe on that point, because this morning we were having a conversation on culture and the challenges that that brings as well. I mean, I was giving an example in the UK. The NHS has a pretty sizable budget. I actually misquoted this morning. It's about 190 billion sterling go to the NHS for a population of 70 million. That's a significant chunk of change, right? Per capita, I think almost 2,500 sterling, and not everybody will use a health service in a given year, so you could see how those numbers can be quite high, and the technology that's being distributed is often very sophisticated and quite expensive. So, how to Harry, how do you think about the soft skills side of things? How do we help clinicians deal with these new tools? So it's not just about having the latest dashboards, but how do you interpret that data? How do you think about digital empathy? We know that oncology patients, for example, might need a higher touch than other types of patients in terms of information and engagement. But of course, the clinician is one, and they don't have time to be texting all weekend and sharing more information, and could be sometimes short one-liners. So how do we think about digital empathy, managing change, interpretation of data? What are the systems that we could, or the skills, I would say, that we need to help to best equip clinicians from a soft skills perspective?
That's a very good question, and I think we need to start with this very, very early on during clinical or medical studies. When I look back during medical school, my medical studies were very old-fashioned, traditional, focused on physics, chemistry, anatomy, and let's say maybe some social, let's say, interviewing and so on, empathy and the likes. However, the digital aspect, and the administration tasks were not part of, let's say, my education at all. And then suddenly you're thrown into the professional life, and here you are, and then you have to deal with patients, administration, politics. And I think to handle that many aspects in a stressful situation requires skills that aren't taught today. And this multitasking aspect, I think, is something we are missing in education.
So it's a learn as you go kind
exactly.
of thing. Harry,
yes.
you I'm sure have a perspective here on this one.
I think doctors need to participate more. I think the skills are there. I mean, the new generations are coming up, they're digitally native. There was a time where we had to teach people how to scroll the mouse wheel, but I think these times are gone. Now, it's about engagement. And I think what doctors need to realize, digital health is here to stay. It's not going anywhere. It's our only chance we have. We have to increase productivity. They need to be involved at all stages. They need to be involved at designing solutions. They need to be into how they're regulating solutions, how they're deploying the solution, implementing them, how they're evaluating them. I mean, we choose what to prescribe, and we choose the prosthesis. We actually do. The suppliers come to us and they pitch their prosthesis, and we choose. I think digital tools is exactly the same. It's part of our practice, and we should be choosing it. And that creates a little bit of problem, what you mentioned earlier with the fragmentation. Many little point solutions here and there, and they all, how do they now all talk together? And I think that is a problem we need to solve. I think we need to start thinking about these digital ecosystems where doctors choose solutions so they can do the job they want exactly the same, but they have the same outcome. I think we need to start moving away from, we have a electronic health record and that solves our problem. I don't think it does. I don't think it ever did. I keep saying that. We've been thinking that it will solve our digital sort of problems in hospitals for 30 plus years. And it hasn't. And I mean, the pandemic was, when the pandemic came, where were all these electronic patient records that we're supposed to track who is where? We couldn't do it. So I think we need to start rethinking a lot of the assumptions we have about digital health. We need to start involving a lot more doctors in how we design and how we deploy these solutions. People come to the hospital to see the doctors and the nurses.
Right.
They don't come to see the digital solutions, and they don't come to see the IT professionals.
Yeah. So I remember the last company I used to work at, Google, I was in the health part of the organization, and we ran this huge survey globally to understand what do patients want the most in healthcare, and by far the largest response was more time with my doctor. Right. It wasn't about, a cooler app or a fancier way of getting to the hospital or maps integrated into the car. It was about more time with the doctor. And how do you release that through the ecosystem to achieve it and drive an improved outcome? And I was just, on that note of sort of collaboration and building together, I mean, is it possible? How do we think about moving away from a functional approach, like this is my product and it's solving this pain point, to doing something that's more ecosystem focused, and what sort of partnerships do we need to think about there? Maybe, Daniel, I'll pass that one to you, but of course a follow-up from anyone here, would be really welcome.
First of all, I think, it's absolutely right. There's a necessity to collaborate. I think innovation in isolation doesn't work and won't work. I think we have seen many, or I at least have seen many startups developing early stage companies that are were developing products developed, let's say, without the inclusion of patients or medical doctors. So I think it's absolutely vital to have clinical expertise, technical and product development skills applied in a patient-centric manner from the get-go. Now, what does that mean, in my view at least, as an early-stage investor, what does that mean for a health tech startup, since we're here at the health tech conference? I think, and I have seen many companies, many early-stage founders that had little knowledge about the workflow where they want to place their product in. And with that, I mean really every detailed step by step, basically every click a clinical doctor has to do to basically, in a software system, to get to the next page, for example. I think you have to go down to that very detail, and you need to have that understanding to understand what are the problems of a clinical doctor or of a patient. And secondly, I think, there are different types of medical doctors, and sometimes they're all thrown into the same let's say, bucket, but if you talk to a surgeon compared to an internal medicine specialist, I think those are different types of people, and you need to approach these people very differently. If you know that, I think you have a big chance to create an excellent product. And obviously engage them at product ideation stage. And how do you do that? Ideally, you can convince someone, let's say key opinion leaders or respected industry leaders, clinicians, medical device, or senior executives that can really help you to open doors into clinics, into clinical associations, but also into patient associations. And I think through this you can really ask for feedback, get input, and iterate early on to create products that really fit into the very complex healthcare workflows.
Great. Anyone has a follow-up to that? And I'll add a slight twist, an example of where it's worked really well.
I have a few examples, but
No, I think this is, we're all medical doctors here, and I feel that there is a strong alignment when we say that, we've all seen solutions developed by teams of engineers that are so complex and difficult to use that they're only meant for other engineers to use. And if, to Daniel's point, if from the get-go they're not designed as a value proposition towards the medical doctors, not super clear and crisp that this improves outcomes, saves time, saves resources, then you need to redesign the whole approach.
I'm keen to hear your positive examples.
Oh, great. Yeah. So I'll go a little bit into the workflow thing,
Yeah.
because it's what we do, right? So I'm very familiar with it. So and workflow is what it's mostly about. It's not about documentation. People think it's about documentation, but the practice is all about moving patients to the next phase and try and pull patients as many as possible through to the next phase. So a good example is we did a great project in North England where we were processing skin cancer across the region. So it involved many clinics, 300-400 general practice offices and 4 hospitals and biopsies and medical photographers. The total volume was around 50,000 a year. So it's a high volume implementation with many professionals involved across the region. And you needed to reach to people that it could be in remote areas, so you need to have mobile units and so on and so forth. So it was a case of really going down to that workflow, to the detail of the workflow, how patients move and how patients move into that journey and out of that journey. At what point do they need to go for photography or for biopsy, or for a face-to-face consultation and so on and so forth. Mm-hmm. And we started achieving the 2-week target from presentation to definite diagnosis, including biopsy for skin lesion. The region was achieving a 5% within 2 weeks, and we got that to 95%. Wow. So I think we can do it, and we can keep the cost the same. We do not need to employ a lot more doctors and a lot more offices. We can do it with what we have. We just need to be a lot more deliberate in how we move patients along so they're in a constant flux and they don't start bottlenecking the system at different points.
Mm-hmm. And aligning that system, the collaboration piece.
Exactly,
yeah.
But we can't see it. It's not a factory line because they're people, and people have anxieties and have questions. And sometimes, some people are vulnerable. Some people need guardians. So you need to do it having that understanding. And how can you get everybody moving along and everybody getting to that definite diagnosis 2 weeks down the line?
Yeah. Mm-hmm. Yeah.
That is the aim. And I think that's where the digital technologies can help. I think this, unless we want to supplement the cost of that care and deploy a lot more doctors, a lot more dermatologists, a lot more equipment, I think we need to rely to digital digital soft solutions to do that for us.
Yeah. Mm-hmm. This is a great example, and brings us back to your initial question. What has changed over the past 10 years or so in digital and digital health? 10 years ago, it was a hypothesis that digital could dramatically improve cost of care. Now, it's a fact, and we're seeing more and more of those great examples where you have robust impact. But the challenging part for Sidekick's journey is that we show this cost of care impact in Europe, and with these governmentally run systems, they are somehow not as well incentivized as the US health insurers to act and implement. Mm-hmm. That's why a lot of focus in our work goes into servicing the largest health insurer in the US that sees this and acts on it, but I haven't seen the NHS acting on anything at scale yet.
Okay, sounds good. We're practically at time, but if you could just leave us with one sentence takeaway from each one of you. Fast forward to 2030, magic wand moment. If you'd like to see a change for the clinician with digital technologies, and how they're adopted, what would it be? I think we already heard a little bit about that, but let's go down the...
I'm foreseeing practicing physicians saying to themselves, how on earth did I practice without these digital tools 5 years ago?
Well, I can't leave this stage without saying AI. So my takeaway would be AI would be of some help, but it will not be the solution.
My takeaway would be look at what you want for as a patient and then take the journey backwards.
Okay, a good one.
And yeah, from my side, I think we see a shift in the industry, slowly but surely moving away from a reactive disease treatment industry to industry that is proactively taking care of our health. And yeah, looking forward to in companies that are supporting these trends. Looking forward to meeting you guys.
Thank you very much for your time today. Please, ladies and gentlemen, warm applause for them.